Hi, welcome to your Module 6 Medical Terminology quick tutorial. So this is for your WWCC NRST 1510 Nursing Assistant class. Again, this is just a quick tutorial over the module, over Module 6. So please make sure you go back to Health Center 21 and complete the whole module. That's where you'll find more PowerPoints, your tests, and quizzes. Okay? Let's go over your quick reminders. Again, watch your grade. Make sure you're 75% or better, and if you're not, start taking better notes. Ask the instructor for help. Let us help you and make sure you're successful with this class. And if you have any questions about your about the grade, please see your syllabus also for details. Also, another reminder: make sure you're prepared for lab and clinical. The stuff that you need for lab is a packet of paperwork, which is located under course information. And also you can wear regular clothes to lab. However, clinical, you are required to wear your scrubbed top and pants and walk the white shoes. So like the sample down here at the bottom, here's a white top, here's some black pants, and here's some white shoes. We'll give you a name tag at clinical. Also make sure your hair is pulled back. And if you have any other questions regarding your dress code, make sure you see that policy under course information. Again, for clinical, you also are required to bring a packet of paper that is also found on your blackboard. If you have any questions in regards to your lab or clinical, please ask your instructor as soon as possible so you can get that taken care of. Also, a reminder is we're not responsible for your housing or your food, so make sure that you have planned housing if you're traveling to our area, and we'll make sure you have that all taken care of. Okay, let's get started with your medical terminology module. This is just an overview, so I'm going to try and make it quick so you're not stuck on this video for a while, so you can get busy with your actual work. Medical terminology is is like learning a new language. It does come from Greek and Latin words, so it does take time to learn it. It's built of roots, suffixes, and prefixes to make the language easier to learn. So if you know a root, then you can piece that together with a prefix. And so even if they're coming out with new words all the time, if you can break that apart, then you can find that word meaning. Okay? It is critical that all medical and healthcare workers have a strong knowledge of medical terms. So if a nurse or a doctor or a physical therapist, if someone is delegating a task to you, you know what they're talking about. When you don't, please ask. Don't pretend like you know and do it incorrectly. Go and ask the person and have them help you learn what she's talking about, or he. Okay, it just helps us provide better care. Okay? Word parts, well, all medical terminology is broken down, like I said, with a root, a prefix, and a suffix. So as you're going through these modules and they're giving you examples, please start your flashcards so you know what they're talking about. I do have some examples here at the side that has the root is in blue. So HEPA, V, and O cardio. Okay, those all mean liver, vein, and heart. So if you know that, looking at it, already you can kind of get an idea of what those words are talking about. Okay, prefixes at the beginning of the word, those are the ones in green. My little person will show you green, prefix, blue, root. Suffix is in yellow. This is just for your learning purposes. You're not going to see all medical words broken down in colors, okay? They're just wrote normally. I just want to point out that you have learned a lot of this before in grade school. So disrespectfully, for example. Respect is the root, dis is the prefix, and fully is the suffix. Uncomfortable. Again, the root discomfort, the prefix is un, and able is the suffix. So as you can tell, we have learned how to break a word apart. Now you're just going to apply that to to medical terminology. Again, starting flashcards as you go through these modules. Remember, understanding medical terminology will improve your comprehension of reports and other medical literature. So if you're going further in your medical career, then you want to be able to understand what you're reading. Just want to break it down. Usually the roots, right here, the roots, those tell you the location of what we're talking about in the medical field. They also, all terms do have a root. So as you look at this little form here, if we talk about skin, of course there's broken down to different systems of the skin, but that's why. So you know exactly where to go. So if I was using the word derm, then you know that it's talking about skin, and seb is subcutaneous glands. If I wanted you to go to the digestive system and I said hepa, then you know I'm talking about the liver. Okay, so each one, this is great to maybe pause and start writing out some cards, and or if you want this form, I'll make sure it's attached to this announcement. Okay. Word suffixes and prefixes. This first page just kind of goes over suffixes over here to the left. So if suffixes are usually describing what's happening. So if someone, let's see, if maybe something's enlarged in that body, then we call it megaly. Okay? Maybe it's something's getting destroyed or a cell's getting destroyed, then we call it lytic. Okay? So the suffix is telling you what's going on with your root. Okay? It also might describe a procedure, condition, or disorder of that disease. Okay? The prefix is usually talking about, is added to the root to change the meaning. It might mean a time, a number, or a location. We click down to the root, okay? Or to the prefix. Here's all your prefixes. Again, this isn't all, this is just the common ones. So again, if you start memorizing it, if I say tacky, then you know that means fast. So if I said tachycardia, you would know that is tachycardia. Okay? So you start breaking down your words. And remember, a root can't stand alone. And if I give you a word and you don't understand what that word means, if you break that apart using your medical terminology knowledge, then you can understand what you're talking about. Moving on, abbreviations. It's another way we communicate in the healthcare field. Abbreviations are shortened forms of words, usually just letters. The healthcare workers, we need to learn these also and memorize them. Again, flashcards are super handy, especially if you're going on in your healthcare education. A lot of institutions have different approved lists of abbreviations, so when you get hired on somewhere, ask them. They're usually in a policy or a handbook somewhere, okay? And these are just common ones. Again, I'll attach this, okay, to the announcement, so if you want to print these out so you can make flashcards, you can. We use abbreviations still in normal life also. Examples 1, EX, it means example, ETC, etc. Okay, so we do use medical abbreviations elsewhere. However, here's examples just for medical terms. So PO is by mouth, EPRN is when needed. So even if you're not working and you go and pick up a prescription for yourself, you can read the bottle without asking the pharmacist exactly what it means. The next section, your Health Center 21, is your atomic references. Great to know because we use these to tell you exactly what to do with the body. So if I said, let's turn your patient laterally, you know which way to turn her, and so on and so forth. So when you're going through that Health Center 21 lesson, making sure that you're also making more flashcards so you can memorize exactly where each plane is located, the directional terms, maybe the body cavities, and also the abdominal regions. So as you can tell, we use lots of medical terminology and abbreviations and atomic references to communicate with our staff and other healthcare workers. So making sure during your Health Center 21 modules, writing them down, making flashcards, any way that you need to know to start memorizing this information. Okay? I will attach the forms, like I said above, so you can start memorizing them. If you have any questions or comments or concerns or anything that we need to know as an instructor, please communicate that with us by email or calling us, allowing us 24 hours to respond. And if you have any questions, again, let us know. Thank you. And